Welcome to this Medality course on HRCT. I'm Jonathan Chung, Professor of Radiology and Division Chief of Cardiothoracic Imaging at University of California, San Diego. I'm also an clinical associate at the University of Chicago, where I also do research. It's my pleasure to be presenting here. We're going to be discussing some didactics on HRCT, but also more importantly, we're going to go through a ton of cases. And I think through those cases, you're going to learn quite a bit in addition to the didactics. So why complete this course? So number one, obviously, you're probably here because you want to learn more about HRCT, or maybe in your own clinical practice, you feel like that's a weakness. And so if that's true, welcome. This course is definitely for you. But for those of you guys who are kind of on the fence, should you complete this course, the next slide will explain to you why it's so important, really paramount for us as radiologists to be really well versed on ILD assessment on HRCT. It has something to do with pathology, but again, I'll leave that cliffhanger there just to kind of keep you on course here. Overall goal of this course, I mean, I say goals, but really it's one goal, is to get better at ILD assessment on HRCT. It can be challenging. It's one of those things where when I talk to my friends in general practice, they say it's common enough where it's irksome, but it's not common enough where you get good at it. It's one of those kind of things. So you have to read them, but your mastery, or at least your confidence, maybe you're actually pretty good at it, but your confidence in reading them is fairly low. So we want to get rid of that. We want to increase the confidence. We want to make sure the mastery is there in terms of ILD assessment. General overview of how we're going to approach and really get this categorized in our minds is that we're going to use a pattern-based approach. So we're going to start with pulmonary fibrosis. We're going to have a section on nodular lung disease, section on cystic lung disease, and then we're going to have a section on interstitial lung abnormality and progressive pulmonary fibrosis. After all those sections, there will be some cases. Some of these sections will have many, many cases, and some will just have a few. So here we go.